Hey, welcome to EMS Office Hours. This is Jim Hoffman and your Monday Minutes. Today I want to finish up part 2 of the medical legal aspects in the EMS Quick Study series. And then next week we're going to start getting into things like anatomy and physiology and stuff like that. Stuff that you'll probably be much more interested in. Okay, but we got to finish this stuff up because this is important. And why is it important? Well, we talk about exam preparation, and that's primarily what these EMS Quick Study videos are for, right? They're to help you sort of retain and recall key elements of EMS content when you're taking your exam. And believe it or not, this medical legal stuff is a certain percentage of every EMS exam, right? You know, especially when we talk about state exams, national exams, regional exams, okay? So this is the type of stuff you want to sort of recall when you're getting into your exam prep mode, okay? So again, this isn't really this is the type of thing, again, you can go for hours at presentations, but in this case, I'm trying to hammer home these key points to help you recall this information when you sit down in an exam. And a lot of the things I'm talking about right now also are things you're going to see almost verbatim when you talk about looking at what the verbiage is on an exam. Okay, so let's get into this part 2, and we're going to finish up and start talking about confidentiality. And when we talk about that, of course, we mean things like HIPAA, but we're going to focus when you talk about keeping the patient's confidentiality. It includes, it's not really limited to these things, but we're talking about things like the patient's history, their assessment, your findings, and treatment that you might have rendered to the patient. Now, if you want releasing this information improperly, it could lead to charges of invasion of privacy, breaking the HIPAA laws, defamation, or even things like libel and slander. And libel, just so you guys know, is something you might see. Libel and slander, you might see these on exams. And libel is that act of injuring a person's character, right, or their name or their reputation by false or malicious writings, okay? So that's something that you might see on an exam, okay? Something like libel. Just keep it the libel is the act of injuring their name or their character. Now, slander is the act of injuring a person's character or their name by spoken words. So libel is the written words and slander is the spoken words, okay? Keep that in mind because you might see one or two of those on an exam, okay? Now, talking about consent, and this is, of course, a big thing. We talk about the things in EMS, talk about consent, and we want to kind of focus on these 4 elements, right? The express consent, which is that verbal, nonverbal, or written communication by the patient that they want to receive medical care, right? Now, informed consent is that consent obtained only after the patient has had those risks and benefits explained to them, okay, and explained in a manner which they can understand. All right. Now, involuntary consent. Now, this is that consent to treat based on, let's say, a court order or it's against the patient's desires, right? And this is something when the patient has a mental problem, if they're incarcerated, things like that, we don't really have a choice for that type of thing. Now, keep in mind, now the next thing is implied consent, right? Now, implied is that situations where you get a patient, let's say they're unconscious patient, right? Where the care is initiated under the thought process that the patient would want you to go ahead and care for them if they were conscious, right? And able to make that decision. So there's a little bit of a difference there between implied and involuntary. Look, don't get those two confused, okay? A little slightly different meaning there, okay? So keep those in mind, especially, again, taking that test. Keep those little bitty nuances are important to remember. Now, some other terms I think are important for you to know. And you might see these on an exam where the question might say, you're stopping care without giving your patient to another qualified healthcare professional, or without giving it, bringing the patient to the hospital. You just stop care and leave them on the side of the road, right? That is called abandonment, right? So abandonment is that it's actually stopping the care without handing the patient over to a person of equal or higher training. Okay, so once you start that train, once you start your care, you can't just leave them alone. You got to follow through or hand it over to a patient with equal or higher training. And your false imprisonment. Now, this is that intentional, unjustified detention of a patient against his or her will. And then we go back to talking about things like the consent, right? The involuntary consent, the implied consent, things like that. Now, two other terms real quick. Assault, that's if you're going to be threatening a patient or causing fear of the patient of having physical contact with you, right? So a patient could say you assaulted them if you threatened to harm them if they didn't go to the hospital with you, or you threatened to harm them if they didn't hold still on the stretcher, okay? That can be considered an assault. And a battery is when you actually touch them without their consent. And believe it or not, sometimes battery, you can have people who might say that they were battered because you were roughly taking a blood pressure. These days, guys, you've got to be careful and you've got to watch what it is that you're doing and when you're touching and assessing your patients. Always speak to your patient, okay, and tell them what you're doing, okay? Don't be fall into that trap that you just assume your patients want things done to them. You're going to take a blood pressure? Tell them, I'm going to take your blood pressure. I'm going to start an IV. Is that okay? All that stuff, okay, ties into not just good patient care, but it prevents you from things like we're talking about here. We talk about assault and battery and things like that. Because battery and assault can be criminal, right, where you're hitting them or you're criminally assaulting them somehow, okay? But also can be something where it's just maybe a civil type of a thing, like we're talking about here, where you're not really assaulting them on a criminal basis, but you're doing it where you're in good conscious trying to do something for them, but at the same time, it can be considered battery. So always explain what you're doing to the patient while you're doing it. Keep them informed, okay, with what's going on. Okay, so just some of the things that we're going to keep in mind when we're assessing our patients, taking care of our patients. Guys, just a few more things for this week. Talking about use of force. Guys, these days we seem to be getting, and I've spoken about this in some of the podcasts and some of the other things that I've been doing lately, where it seems like a lot of EMS professionals are being more easily assaulted by patients because patients don't seem to have that filter anymore that they used to. Not sure why that is. Maybe I'm just seeing it more because it's in the news more, okay? But when you have to use force on a patient, only do it, okay, in a way to provide care for the patient. Okay, if you have a violent patient or a patient that's being uncooperative and you have to restrain them for some reason, okay, follow your protocols. Sometimes you have to use soft restraint. Sometimes you have to call the police to restrain them. Whatever it is to restrain them, follow your protocol. And use that reasonable type of force, okay? Don't do it as a way to punish the patient because they've been violent with you. A lot of times these patients have mental issues or even medical issues that are preventing them from coherently participating in their care. Okay, so be reasonable in the amount of force that you're doing. Don't use it as a punishment. And again, follow your protocols. Some agencies have soft restraints. Some agencies have where you use cravats to tie them down. Whatever the case is, but do it in a way that you're doing it that's appropriate to provide the care that you need to provide for that patient. Okay? So, last couple of things. Crime scenes, of course, you want to always provide good patient care at a crime scene and try to preserve evidence. Now, when you see these types of things on the test, we talk about crime scenes, they're not going to probably get too much into what a crime scene is and get into whole legal issues of it, but they want to see that you're going to know that you want to preserve the evidence and that you do want to provide good patient care. You don't want to use the crime scene as an excuse not to provide patient care. And finally, child abuse or even elder abuse, right? Again, every state's a little bit different. Every region might be a little bit different, but for the most part, you suspect child abuse, usually you have to either inform hospital personnel, law enforcement, or even a special phone number you might call to report the child abuse or the suspected elder abuse. Okay, so you don't require proof for this type of stuff, but most of the time it is mandated that you do report it. So make sure you check on that. If you're unsure in your region what your actual requirements are, check up on that, okay? But just keep in mind that when you talk about exams and you talk about EMS quick study here, right? Remember, if it's suspected, you don't have to have proof, but you have to go ahead and report it. Okay, guys, I hope you can use these Monday minutes. Again, these are going to be a little bit longer, these EMS quick studies, because there's a lot of content in each one. But I'm still, even though there's a lot of content, I'm still kind of paring down all the information that you might see in a 500-page textbook into about 100 or so pages of content. I'm trying to break that down into weekly slides and weekly presentations here. Okay, so next week we can go into, again, a little bit into anatomy and physiology. That might be a 2 or 3 part series just for that section. Okay, so bear with me, but when we're all done with this stuff, guys, this is going to be a wealth of information that you can come back to year after year, time and again, and refresh your memory on these key elements to help you pass state exams, final exams, regional exams. Okay, I'm telling you guys, this stuff works. I've used this stuff myself, and when we talk about this type of stuff as well, check out this EMS Quick Study Guide. Guys, most of the information here I'm presenting in these videos is included in this EMS Quick Study Guide. Okay, I'm telling you, this is your 500-page textbook. It's pared down to about 100 pages. It includes all these key elements. This can be a digital or physical copy, either one you want to get. I'll send you an actual paper copy of this book, or you can just download it and have it on your computer to study off of it that way. But really, guys, this is the meat and potatoes of any EMS course. Okay, I've used this guide myself for about 10 years. So even though things in EMS change and the educational stuff changes, these key elements, all right, that we're talking about here and that's included in the guide are still consistent with what's being taught out there. Sure, there's stuff that's added, there's stuff that's taken away, right? But the main content, that underlying thread inside these exams and inside your EMS study and EMS courses are going to be the same, right? Chest pain is chest pain. Abdominal quadrants are abdominal quadrants. You know what I'm saying? So all of that stuff is remain consistent, and that's what this guide is geared for. It's not the overall thing you should use when you study. By all means, I would not say that, but this is definitely the type of thing you can use. You can review it before an exam, or as a quick overview of terms of subject that maybe you're kind of forgetting when you're trying to do your documentation, or you're trying to explain something, on paper, or maybe even with a coworker. All right, guys, I don't want to go on and on. Go check this out. All right, great resource. I can't tell you enough how great this product is right here. Okay, stand behind it 100%. All right, so go check it out. Click here and get all the details on this. So again, guys, I hope you can use these Monday minutes. I hope you enjoy them. Send me an email. It's contact@emsofficehours.com. Post below, either here at YouTube or on the blog at emsofficehours.com. Let me know your thoughts if you want to see this a little bit more in depth on these subjects. Okay, all stuff. Go check it out, guys. Get the previous episode, and please go comment on anything on the blog. I love to hear your feedback. I love to get your comments and concerns on not just these Monday Minutes videos, but also on the podcast episodes, on the microwave medic stuff that I've done there. Go check it out, guys. Lots of content there, and I think it's a lot of stuff that you'll find fun and interesting to watch and read and listen to, and hopefully engage you in your EMS profession. So that's it for me, guys. Until next week, Jim Hoffman for EMS Office Hours in the Monday Minutes. Stay safe.